We're diving into a topic that's, well, incredibly personal and powerful for so many. Navigating pain during labor without medication.
It really is. And it sparks a lot of curiosity, doesn't it? Getting good, solid information is just so important.
Totally. And we've got some great material here. There's a really thorough guide from a hospital looking at comfort measures. So our mission, really, for this deep dive is to explore the why and the how. How do these non-pharmacologic options actually work?
Yeah, how do they work with your body? What are the concrete steps you can take to get ready?
Exactly. And also touch on that crucial role of support and, maybe just as important, staying flexible. The idea is to give you the knowledge to feel genuinely informed.
Okay, so let's start with the core idea. These comfort measures, they aren't just about, grinning and bearing it. They're actual techniques designed for natural pain relief.
Right, tapping into the body's own resources. And the sources point to, what, two main ways they do this?
Yeah, basically two pathways. The first one is pretty amazing. It's about boosting your body's own natural painkillers, the endorphins.
Ah, the endogenous endorphins. So things like pattern breathing, relaxation, visualization.
Yeah.
Even hypnobirthing is mentioned.
Exactly. These techniques help your body produce more endorphins, and those endorphins bind to pain receptors in the brain. It's like turning down the pain volume naturally.
Okay, that makes sense. And the second way?
The second way involves creating competing impulses in the nervous system. Think of it like your brain can only pay attention to so much at once.
Okay.
So techniques like touch or massage or even hydrotherapy, they create other strong, non-painful sensations. These signals compete with the pain signals traveling to your brain.
So they got to block the pain messages from getting through as strongly, like sensory distraction almost.
Precisely. It's a form of sensory redirection. You're giving the brain something else, something pleasant or neutral to focus on.
I like that framing. Not just blocking pain chemically, but creating your own relief or redirecting focus. It's working with the body.
Exactly. That's the key idea.
All right, so let's dig into some specifics. Because the hospital guide especially gives a lot of examples. There's quite a toolbox here.
Yeah, there really is. And one of the most common ones you see now is the birthing ball. Super simple, often right there in the room.
And versatile too, right? It's not just for sitting passively. The guide mentions its background in physical therapy.
And it's generally safe with monitors. There's just a little note about checking with your provider if your water's broken and the baby's still high up.
And they make a good point about having a partner or support person spot you, sit behind you, legs apart, for stability.
Definitely important. And while, large-scale research might still be evolving, the reported benefits are pretty compelling.
Like what? What do they list?
Well, helping keep the baby aligned in the pelvis, encouraging that pelvic mobility, which helps descent. It makes getting up and down easier.
Right, easier than from a bed sometimes.
Yeah, and it lets you rock, shift your weight, find what feels good. It uses gravity. Plus, it can decrease pressure if you're in a hands and knees position. ACOG also lists it as a common tool.
Okay, so moving from a physical tool to something more internal, patterned breathing, that seems fundamental.
Absolutely fundamental. And the sources stress it's not just a distraction. Proper breathing techniques actually enhance oxygen flow.
Which is good for?
Good for the baby, good for the uterine muscle, helps it work more efficiently during contractions. ACOG highlights breathing exercises too.
Makes sense. And then there's movement. Just moving around.
Yeah, movement and position changes. The advice is pretty clear. Listen to your body. Often upright positions, sitting, standing, walking, feel better, especially earlier on.
So staying still, especially lying flat, is often less comfortable.
Generally, yes. Movement feels better, and it actually helps labor progress. Gravity is your friend.
How does changing position help physically?
It subtly changes the shape of your pelvis, giving the baby more room to navigate. Plus, it just shifts pressure points. Simple things, sitting, kneeling, standing, hands and knees, walking around. ACOG really emphasizes walking and changing positions.
Okay. What about things you apply to the body? Like temperature?
Right, superficial heat and cold. Simple, but can be really effective. Think hot water bottles, warm damp towels, or even warm blankets for heat.
And for cold?
Ice bags, cold washcloths, even a bag of frozen peas in a pinch. Applied to places like the lower belly, groin, lower back, perineum, wherever you feel discomfort.
And I mentioned you can even use both, like heat on your back and cold on your front.
Yeah, potentially for enhanced relief.
Yeah.
The key is to keep changing the location. Don't leave it in one spot too long, maybe every 20 minutes or so. Protect the skin.
Got it. And for that really intense back pain, that back labor, There's counterpressure.
Yes, a very specific technique. It's steady, strong pressure applied right to one spot on the lower back during a contraction, usually with the heel of the hand.
Or on the hips.
Or sometimes pressure on the sides of each hip with both hands. It just helps counteract that deep ache.
And then there's just touch, massage. Seems simple, but powerful.
Incredibly powerful. The sources talk about how even a simple touch, a hand resting on a sore spot, a pat and embrace, sends messages of caring, which reduces pain perception.
And then more focused massage, too.
Right. Purposeful massage.
Right.
Light stroking, maybe firmer kneading, deep circular pressure on the neck, shoulders, back, thighs, feet, hands, wherever it feels good to you.
And how does that work? Is it the competing signals thing again?
Exactly. The brain receives these pleasant, non-painful sensations from the massage, and those signals essentially compete with, or gate, the pain signals. Bare skin is often best, maybe with unscented lotion. ACOG definitely includes massage as a key technique.
Okay, shifting senses, aromatherapy, using smells.
Yeah, using essential oils. Lavender, rose, chamomile, clary sage are mentioned. The main idea is reducing stress and tension.
How do you use them?
In massage oil, a few drops in a bath or a foot bath, maybe a drop on your palm to inhale, or on a warm cloth near your face. But there's a big caution here in the sources.
Oh, what's that?
Laboring women can become extremely sensitive to smells. What smelled nice yesterday might be overwhelming during labor.
Ah, okay, so only use scents you really like and stop if it starts to bother you.
Absolutely, don't force it. ACOG mentions calming smells or aromatherapy as possibilities.
Makes sense. What about water? Hydrotherapy.
Oh yeah, that's a big one. Using a jacuzzi tub or even just a shower, it comes up again and again in the sources.
For pain relief and...
Emotional soothing, the warmth, the pressure of the water, even the sound. It's all very comforting for many people.
Does it do anything else?
Well, some advocates feel it can help labor progress, maybe lower blood pressure, and definitely increase a feeling of control, which is huge. ACOG lists water therapy, warm baths, showers as things birth locations might offer.
Okay, let's talk about the mind. Focus and distraction techniques.
Right. This taps into the mental side of coping. The sources point out how fear and anxiety can actually increase stress hormones, potentially making pain feel worse.
So easing those feelings helps.
Exactly. You can do that through active focus, like visualizing something pleasant, picturing your cervix opening, or using self-hypnosis, or concentrating on a focal point or mantra.
Or through distraction.
Yeah, which is more passive, using things in the environment, like music or conversation, to take your mind off the intensity. These might not work as well during the absolute peak pain, but they can be really helpful earlier on, or even for managing discomfort after birth.
And speaking of music, audio analgesia.
Yeah, using music or sound specifically for pain control. It's used in lots of medical situations. In labor, it can obviously help with relaxation, create a more pleasant atmosphere.
Block out other noises.
Definitely, especially with headphones. And it can reinforce rhythmic breathing or even the rhythm of massage.
The key being...
Choose your own music. What one person finds calming, another might find irritating. It's intensely personal.
Absolutely. Wow, it really is a broad toolkit. Physical things, sensory things, mental strategies.
Yeah, and there were a few others mentioned briefly too, like effleurage, that light, feathery stroking on the abdomen.
Oh, right. And simply remembering to empty your bladder regularly?
Surprisingly helpful for comfort and, of course, staying hydrated. Clear liquids, water, juice, broth, ice chips, popsicles.
So that covers a lot of what the techniques themselves. But the ACOG article really digs into the preparation, doesn't it? Knowing the techniques isn't quite enough.
Not quite. Preparation is absolutely paramount, and it starts way before labor.
Like basic health during pregnancy.
Exactly. Taking care of your body, staying reasonably active, eating well, building strength and fitness can genuinely help you cope with the physical work of labor. They even suggest it might lower the risk of needing a C-section.
That makes sense.
Yeah.
And then talking to your team.
Crucial. A really critical step they highlight is letting your healthcare team, your doctor, midwife, the nurses, know your goals. If you're hoping to avoid medication, tell them.
Early on.
Yeah, ideally during pregnancy. The article even suggests writing down your goals to share so everyone's on the same page.
Good idea. And what about where you plan to give birth?
Also key. Before labor, ask your hospital or birth center about their approach. Do they often support non-medicated births? What tools do they actually have available?
Like, do they have the birthing bowls, the showers, the tubs we just talked about?
Exactly. Knowing what's realistically available helps you plan which techniques you might rely on.
And education. Birth classes.
called Vital by ACOG. These classes are where you really learn how to use different pain coping techniques. LeMay's, Bradley, hypnobirthing are mentioned as examples.
But they also teach about pain meds.
Yes, and that's important too. The goal is informed choice. Even if your plan A is no medication, you need to understand the options in case plan B or C becomes necessary.
So learn the techniques, learn the medical options, and then make some choices.
Right. Based on what you learn, the advice is to actively decide beforehand which non-pharmacologic techniques you personally want to try, which ones resonate. Massage, water, music, movement. Have some ideas ready.
Okay, preparation of self. What about support from others?
Huge emphasis on this. Building your support system is presented as absolutely critical.
Who can be part of that?
Your partner, a friend, a family member, or a professional labor support person.
Like a doula.
Exactly. The article defines a doula clearly. A trained support person offering continuous advice, comfort, encouragement, but not medical care. They're there purely for support.
And how do these support people help practically?
They can be your advocate, remind the team of your wishes, coach you through contractions, actively help with massage, positioning, breathing, whatever you've planned.
And if your main support person is, say, your partner?
The advice is for them to take classes with you so they learn how to provide that effective support.
I like how the article frames it. Your support person and your clinical team, the doctor, nurses, they were all one unified birth support team.
Yeah, it emphasizes collaboration, everyone working together for a healthy outcome for you and the baby.
Okay. And finally, that dose of reality, timing, expectations.
Important stuff.
Yeah.
Knowing the signs of labor helps when it might be okay to labor at home for a bit in early labor using those comfort measures.
Like walking, taking a shower.
Right. Versus when contractions are telling you it's really time to head to the hospital or birth center.
But the big message here seems to be unpredictability.
Yes, hugely emphasized. Childbirth is full of surprises. Your carefully crafted birth plan might need to change. Labor can be much shorter or much, much longer than you anticipate.
Which leads directly to flexibility.
Flexibility is key. The ACOG article says it plainly. It is absolutely okay if you end up needing or wanting pain medication.
Even if that wasn't the original plan.
Even then, maybe your body is just exhausted after a long labor. Maybe something comes up where an intervention is needed for safety. That's okay.
And your team helps guide those decisions.
Your whole birth support team, yes. They're there to help you navigate, always with your and your baby's best interests at heart. Trusting that team is vital.
That trust seems really foundational.
It is. They are partners in this.
And I really like the ending note in that ACOG piece about celebrating the birth itself.
Yeah, it's powerful. Regardless of how it happens, non-medicated, medicated intervention, even a C-section, you still gave birth to your baby.
The outcome is the miracle.
Exactly. And that achievement, bringing your child into the world, is always something incredible and worth celebrating. It shifts the focus from the process to the result.
So we've covered a lot, the range of these non-pharmacologic techniques, how they actually work with your body's systems.
And then the crucial pieces around preparing yourself, physically and mentally, building that support team.
Communicating your goals clearly, and maybe most importantly, embracing that need for flexibility and trust.
Yeah, it's clear these sources aren't just giving a menu of options, but really a whole approach to feeling more prepared and hopefully empowered.
So thinking about all this, the unpredictability, but also the power of these techniques, the preparation, the support, how does this whole exploration maybe shift how you think about a potential labor journey? Or perhaps how you might support someone else going through it?